AI minds, quantum leaps. Cut the noise, dive deep. Truth unlocked. Dr. Mike on the mic. Tech Unfiltered is on the clock. Now it's time for the show.
All right. So imagine your entire messy medical life, every lab result, every weird number your doctor rattled off in 12 seconds, every sleep score from that watch you bought and forgot about, all of it, suddenly living inside your chatbot. That is the news. ChatGPT Health is rolling out across the United States, and it is a big deal. So let me break it down for you. Here is the bottom line up front. OpenAI is letting eligible adults in the US, age 18 and up, connect Apple Health and supported medical records straight into ChatGPT. And this is not some walled off little health corner of the app anymore. With your permission, that context can now show up in any conversation you are having. You can be asking about, I don't know, a restaurant that will not murder you because of your shellfish allergy, and it can pull from your health info to help. You literally tag it with the @ symbol and the word health, and it reaches into your records. That is the whole shift, and it is not tiny. OpenAI says more than 300 million people ask ChatGPT Health questions every single week. Every week. That is a small country of people typing, "Why does my knee do that?" into a text box. So this was always coming. So what can you actually plug in? Apple Health, which needs an iPhone, by the way, plus medical records from a bunch of US hospital systems, One Medical and Function Health. And here is a nice detail. Your wearables and fitness apps and nutrition apps, they can feed in too, but only if they share through Apple Health. Now, OpenAI is honest about one thing here, which I respect. Those fancy proprietary scores, your special readiness number, your magic sleep grade, those might not transfer. Different apps, different metrics, so do not expect every shiny gauge to make the trip. Now, let me tell you the genuinely useful part, because there is real value here, right? Medical information is a disaster. It is scattered across 7 different portals, and after namely its summary, you cannot find a lab table that looks like a spreadsheet designed by a villain, a medication list, and a wearable graph. Nobody organizes this. And a conversational tool is actually good at exactly this. It can translate the terminology. It can line up your numbers over time so you can see a trend. It can help you compare a new lab value against the last one. And this is the one I love. It can help you prep sharper questions before an appointment, because your appointment is 9 minutes long and half of that is the doctor logging in. So walking in with organized questions, that is a real win. That could genuinely make people better at their own health. I am into that part. But, and you knew there was a but, because if I looked any better delivering good news with no catch, it would be problematic. Here is the catch. The risk is over trust. Let me be very careful and very clear. Because this matters, ChatGPT Health is not a doctor. OpenAI says it directly. It supports professional care. It does not replace it. It is not for diagnosis. It is not for treatment. It is not an emergency service. If your symptoms are urgent or getting worse, you call a human. You do not sit there negotiating with a chatbot. OpenAI itself tells you to seek immediate professional help in an emergency. So that is not me being cautious. That is the makers of the thing telling you the same. And here is why the over-trust thing is sneaky. And this next part is my editorial read. So I am labeling it as my take, not something OpenAI said. When an answer is personalized, when it uses your name, your numbers, your history, it feels authoritative. It feels like it knows you. But a polished summary is not a diagnosis. The model can be missing a critical detail. It cannot look at you. It cannot feel that your ankle is the size of a grapefruit. And the more personal and smooth the answer sounds, the easier it is to just believe it. The usefulness and the risk, in my view, they rise together. More context means a more relevant explanation, sure, but it also means a wrong conclusion sounds way more convincing. Keep that bright line. Help me understand this is great. Tell me if I need treatment is a different building. Okay, privacy, because this is your health data and you should be a little paranoid in a healthy way. Let me give you the reassuring stuff first, and I am attributing all of this to OpenAI because these are their claims. OpenAI says your connected medical records and Apple Health info and the chats that use that data are not used to train their models and not used to target ads. Does not matter what your normal training setting is. They say chats are encrypted at rest and in transit with extra encryption controls on the connected health data. The connection is read-only, which is nice. ChatGPT cannot write anything back into Apple Health. It reads, it does not scribble. And the permissions are granular, which is the good design part. By default, it asks before it uses your records to personalize an answer. You can say yes this once, or you can hand it standing access forever. And that difference, huge. Here is my worry, and again, my editorial read. It is consent drift. A one-time yes is easy to understand, but always allow fades into the wallpaper. And because your health context can be relevant when you're talking about food, travel, exercise, daily planning, all of it, you might forget it is even being consulted. So my strong advice, keep the per use permission unless recurring access is obviously worth it, and go review that setting once in a while. Now here is the detail almost nobody will read, and it is the one that will bite people. Disconnecting is not the same as deleting. Follow me. If you disconnect a data source, OpenAI says the synced data gets deleted from their systems within 30 days. Good. But anything that already got copied into your chat history, a value, a summary, a sentence, that stays until you go delete those conversations yourself. So disconnecting the portal and deleting the chats are two separate chores. Two separate buttons. If you only do one, you left a paper trail. Make sense? A couple more things worth knowing. The privacy notice says a limited number of authorized people and trusted service providers may access this data for safety improvement unless you opt out. So not used to train the model is a real protection, but, and this is my inference, it is not the same as no human being on earth will ever process this. There is a whole life cycle here. Hosting, cloud, support, safety monitoring. OpenAI does say it does not sell your personal data. Just do not let one comforting slogan do all your thinking for you. Also, memory. This is subtle. OpenAI says memories can be created from your health conversations, depending on your settings, but not directly from the connected records themselves. If you want to keep this stuff quiet, you can use temporary chat or turn memory off, or even run a separate project with its own memory so your health talk does not bleed into everything else. Oh, and the models differ by plan. Free users get one model for health questions, and the paid tiers get a stronger one that is better on complex stuff. That is just the product reality. It does not automatically mean a free answer is dangerous or a paid answer is gospel. Verify either way. And I have to mention the cloud over all of this, and I am going to say it exactly right. There is reporting from SiliconANGLE that a lawsuit was filed in California alleging an earlier ChatGPT model discouraged someone from seeking care before a serious medical emergency. I want to be crystal clear, those are allegations. They have not been decided in court. OpenAI pushed back and said medical decisions should not be based on the chatbot alone. So, allegations and responses, not settled fact. But it is exactly why the do not replace your doctor line is not boilerplate. It is the whole ballgame. So here is where I land. Use this thing as your translator and your appointment prep buddy. Let it explain the jargon, organize your timeline, and hand you 5 good questions. Verify the important numbers and medications against your actual patient portal because records go stale, a med stays listed after you quit it, scores go missing, and when something is urgent, you close the app and you call a person. That is the deal. Health data as ambient context for an everyday assistant. Genuinely useful, genuinely consequential, and 100% worth being a smart, slightly suspicious grown-up about. Questions, comments, concerns, bribes. I will see you in the next one.